I want to welcome you to the second day of the virtual Pharmacon. I hope you enjoyed the lectures yesterday and that you are ready for the new booster. Today is with you the organizing committee. I am Eva, and with me here is Jelena. Marin, Kaya Eva, and Victor. Smile and wave, guys. Smile and wave. I also would like to give you some guidelines for using the virtual room. You may see the icon in the upper tab, Set Status. That's the little man raising his hand. You can use it if you want to agree, disagree, inform the lecturer, to speak louder, to slow down, to speak faster, etc. If you have any questions during the lecture, you can write them down in the chat box, and we will read them at the end. I hereby announce the second day open, and I give words to Jelena, who will announce the first lecture. Let the Pharmacon begin.
Hello everyone, and I have the honor to announce the first lecture of the second day of our virtual Pharmacon, Mr. Brendan Murray, who will be holding a flash lecture about the clinical pharmacy in the UK and Republic of Ireland. Flash lectures, unlike our regular ones, are 15 minutes long and are focused on demonstrating to students all around the world different career opportunities. Mr. Murray is a community pharmacist in the Republic of Ireland. He has previously worked as a hospital pharmacist in the United Kingdom. As well as having studied pharmacy, he also has a previous degree in biotechnology from the National University of Ireland, Galway. He studied pharmacy at the University of Portsmouth in the UK and completed his pre-registration training in hospital. He then went on to work as a hospital pharmacist for over 2 years. He first got involved in pharmacy organizations back in 2010 when he attended a student pharmacy conference in the UK. In 2013, he was elected onto the BPSA executive at the European office. In 2013, he attended his first FIP Congress in Dublin, and since then has attended as many FIP World Congresses around the world as possible. And finally, in 2014, he decided to start encouraging young pharmacists and pharmacy students to attend more pharmacy events around the world and get more involved in their profession. And the initiative, for which is he most famously known for, is called The Enthusiastic Pharmacist. So is Brendan with us at the moment?
Hi everyone, my name's Brendan Murray. I'm a community pharmacist in the Republic of Ireland. So I've basically been asked by you guys to do a presentation on working as a hospital pharmacist. And I want to talk a bit about working in the UK, working in Ireland, what a clinical pharmacist actually does, and also the training needed and a pre-registration pharmacist in the UK undergoes. So the first slide I have is just my background. Can you guys hear me okay through that microphone? I don't know if it falls up anywhere or anything. Voice isn't clear. Okay, not clear enough. Oh, I'm trying to. This is really annoying now. Let me see if I can. Is that a bit clearer now? Some people are typing. Multiple attendees are typing. It's better, okay. It's a little better, okay. I'll try and speak a bit slower, okay? I'm sorry about this. So basically, I started off my education in the National University of Ireland in Galway. I basically did Galway for 4 years. I went to the University of Rochester in the States as a lab placement. After that, I went to the UK and I studied pharmacy. I did my training in hospital. I also got involved with the BPSA, so student aspect of things. I basically represented the UK for a year at the European Officer, so I attended a lot of EPSA events and international events. I set up a thing called the Enthusiastic Pharmacist, and the whole purpose of that is trying to encourage more young pharmacists and pharmacists to attend national and international.
Dobra.
And when I said I worked as a hospital pharmacist for 2 years. And now I've recently got involved with FIP. So I don't know if any of you guys heard of those guys before, but they're the International Pharmaceutical Federation. And I currently sit as the Public Relations Officer for the Young Pharmacists Group. So that's a bit of a mouthful, but that's basically what I do in my spare time. So, like, the whole area of clinical pharmacy and career progression is massive. So I decided I just cut to a couple of bullet points of the actual structure of the training as a hospital pharmacist, and what a clinical pharmacist actually does, what way you can progress your career, and then how can you guys actually get involved and get experience. I was recently at the EPSA Autumn Assembly in Romania, and there just seems to be a massive urge from all the countries in Europe, and indeed across the world, of more clinical pharmacy like what's happening in the UK. So let's go to the next slide. So the training in the UK, so as with most European countries, you study pharmacy for 4 to 5 years. In the UK, it's a 4-year course, and in Ireland, it's 4 years as well. And so after your 4 years in the UK, you do what they call a pre-registration training year. So you train to become a pharmacist, essentially. So if you use everything you learned in university and you put it into practice, it takes quite a long time to get this completed. It's a full year's training. And literally what I posted up here is from the GPHC, or the General Pharmaceutical Council. There's actually a link on the bottom if you guys want to click that later, and it goes through all the criteria that you need to fulfill during your year. So you have to get your tutor, has to sign off on every little thing, and there's 70 different things you have to get signed off on. In hospital, you need 5 pieces of evidence for each one. So you can see you need hundreds of pieces of actual documented written evidence to say that you're ready to sit the exam. So every couple of weeks you need to get signed off to say that you're up to speed with your training. If things aren't going well, yourself and your tutor can work on that to get you more help or focus on certain areas. And also at basically the 3rd week of appraisal, which is 39 weeks into your training, if everything is going well, then you're basically okay to sit the exam. So, I mean, I can talk through the exam, but I don't know if that's of much benefit to you guys. It's literally a full day, it's 2 papers, and it's quite challenging. It is quite hard. And so what happens then? So I basically just put up the actual training that you undergo as what they call a pre-registration training in the UK. So in other words, you do your basic things like you'll do your dispensary work, how to dispense, how to label, how to check medications. Then you'll go from the wards and you'll do lots of training with pharmacy technicians. They do things like medicines reconciliation. You might have heard that word before. Essentially, it's drug history. When a patient comes into the hospital, you need to find out what medicines they're on. And so sometimes the patients are elderly, they're complex, they have Alzheimer's, they have Parkinson's, and you can't talk to them. They're either asleep, they're injured. So you have to either ring relatives, ring doctor's surgeries, get in touch with anyone who knows them and find out what medicines they're on. And there's also the clinical pharmacy services of actually checking patients' medicines that they're prescribed in hospital. A lot of the prescribing in the UK is done by junior doctors, so they're essentially trainee doctors. Like, they're on the register, they're able to practice as doctors, but obviously they're very new, they don't have much experience. So the clinical pharmacist is there to help them, and if they need advice, they can come to you. So you will find if you're working as a clinical pharmacist, the doctors will approach you and they will ask you, is this the correct antibiotic? Have I prescribed this right? Can you locate this medicine for me? I don't know if we keep it in stock in the pharmacy. Sorry, we speak very fast in Ireland, so I'll try and slow it down a bit. I know I'm speaking very fast. So you also do placements in medicines information. You do a couple of weeks in community pharmacy. A lot of the hospitals in England, I can't understand most of the speech. Sorry, I'll slow it down more. Sorry about that. You do work in aseptic pharmacy, so this is where you produce chemotherapy. So a lot of that is made in each hospital in England. You also do a placement in mental health, so you go with the mental health pharmacist for a number of weeks. There are a couple of optional training things that not every hospital pharmacy will have. Things like a radio pharmacy, where they'll essentially make up a lot of the radioactive dyes they'll use in scanning patients that the radiologists will actually use. And then large-scale production, so literally these will be production sites where other hospitals can purchase specialized medicines, and they actually get them made for individual patients. So now, what other bits I want to talk about training? So again, I've just put this is the structure of what my training would have looked like. So these would have been all the different places or areas that I would have done it. So they start you off just like they would a pharmacy technician. You start off in pharmacy stores where medicines come in, are delivered to the pharmacy, and you go right up to the stage where they're actually administered to the patients. I found the training in the UK really, really good, because not only do you do your training with your other trainees in the hospital, but you also do every couple of weeks you'll go to London and you'll do like an area training. So you have lots of trainees from around that region, so 60 or 70 students, and you'll come together for a training day on a specific topic. And it was very, very good to have that, because you could talk to other trainees and see what problems they had or what things are going really good for them. And that's how you learn. You learn from each other, basically. So what else is there? I literally posted this up. I literally copied this out of one of the training manuals. This was the number of weeks that you would spend in each area. So you can see like some of the ones I talked about for the optional training ones. Them ones, not every hospital will have them, especially the smaller hospitals. But if you go to a big teaching hospital, say in London or Southampton or Newcastle, you'll probably undergo all of these optional ones. As part of it as well, you have to do an audit, so usually that takes a lot more than 1 week. For me, it took a number of weeks to do because you're doing it in the evening. So you would review, say, for example, a clinical service, like a specific drug that was administered to hospital. And obviously in the UK, a lot of the hospitals have electronic prescribing. So it's very, very easy to collect the data for a specific drug of where it was prescribed and how much and who prescribed it. You collect all the information. It's very, very good. And what else? So it's important to remember that even though you're working in a hospital as a trainee, you're not a pharmacist. So you can go up to the wards, you can do all these cool things, but you are not on the register. You cannot practice as a pharmacist. So anything you do has to be supervised. So it's very important to remember that. During your year, the hospital, the staff will try and train you up to do certain things on your own, because at the end of the day, the hospital is paying your salary, so they want to get some work out of you. So, one of the things I mentioned before is that you actually do medicines reconciliation or take drug histories from patients. So generally in the morning, if you have some free time, you'll be doing that. Once you're after a couple of months, say 5 or 6 months, you'll be doing your own drug histories. You'll do warfarin counselling with patients, or what they call NOACs or new oral anticoagulants, like dabigatran, rivaroxaban, apixaban. And essentially, when you're getting to the end of your training, they want you to be able to walk in the next day and work as a pharmacist. But that's what it's all building up to. Could you close the, what's that someone said? Could you close the video? You want to close the video, yeah?
I'm not completely sure that would fix the problem, since we're doing this through WhatsApp. That is just a thing that people listening to the conference should know, since we had sound problems. So I don't think the sound quality has any connection to the video. So we can just try and do the conference this way. I don't think that the speed, internet speed, is the problem at this point in time.
But this is, if I maybe connect to the internet on my phone, that might help. This might help a bit, but I don't know if it will. Is it okay to continue?
Sure, go on.
Okay, sorry. So my own personal experience, so I'll just bring up these, there's 3 or 4 points about doing training. So I found it very enjoyable, because working in hospital was very hands-on. If you're doing your training in community in the UK, sometimes it gets a bit repetitive, because you're in the same place, you're working with the same staff. It's kind of hard to learn new things, because you're working in very busy pharmacies and very busy situations. But overall, I found the training very good. I did find it challenging, because I was involved a lot with student organisations, and I found it difficult, because it's hard to make time to do everything. It's very hard to do everything, because if you start saying yes to everyone, soon you'll end up with no time for yourself. So it's very, very important when you are studying that you do make time for things that you like doing in your spare time. It's very important. So let's go on. I think I'm talking more about the role of a pharmacist. So this is like what a normal day if you're working as a pharmacist, as a clinical pharmacist. So literally you would come in and sometimes you have to do an hour or two in dispensary every day to cover a dispensary slot. So you will be working as what they call the responsible pharmacist. So anything that happens in the dispensary, it's your responsibility. So you kind of have to be in everyone's business, knowing what's going on, knowing what prescriptions are coming into the pharmacy, know what medicines are being delivered out of the pharmacy. So you would do what they call clinically screening prescriptions. So you check it, the standard things that you're taught in university. Is this the right medication for the patient? Is it the right dose? Is it a child? How old is the child? What weight is the child? You check the patient's blood because you have access to all of the records on the computer. Then obviously you basically do lots of checking as well. So medications, once you've clinically checked this, a dispenser will dispense the medication, or a technician, and then you will check it as a pharmacist, or technicians will check it. Then obviously when you're up on the wards, then in the afternoons, you'll be working on discharging patients. You'll be making sure they have all their medications to leave. Generally, when a patient leaves the hospital in England, they have at least 2 weeks or 1 month of all their standard medications. It's a lot different in Ireland. They tend to discharge the patient with the bare minimum amount of medications that they have and give them a prescription to go to their local pharmacy. So that's a bit of a difference between the two countries. And what other things will you be doing? You'll be up on the wards. Generally when you go up to the wards, if you introduce yourself when you're doing your rotation in a specific area, the staff are really nice. The nurses will get to know you. The physiotherapists will get to know you. The carers will get to know you. And most importantly, the doctors will also get to know you. So if they have problems, they'll bleep you, they'll ring you, they'll ask you for help. And likewise, if you need a prescription for something or you need a doctor to change something, generally, they're very, very good. They'll reply to you and they'll get it done. Because at the end of the day, they're not there just to do their job. They're there to try and get the patients well and get them home. That's the main goal. What else would you do then? These are literally some of the resources you would use when working as a clinical pharmacist. So not every hospital would use these specific programs. Some of them are computer programs, like Datex, for example, is where an incident happened. So say a person was given the wrong medication and got ill, or a person took the wrong medication as an accident on the ward, or someone fell, or something like that. You'd have to do a report on it, and it will be submitted to the hospital as an incident. Other things like the ICE program was for blood results. If you had any problems with interactions, you'd be using like your BNF. That's children's BNF there. The electronic prescribing system, you can look that up online if you want. It's called JAC. So a lot of the hospitals in the UK would use that program for prescribing medications, and I think there's lots of videos on YouTube as well. So they're just some of the resources you would use. What else? Okay, so before I just put this slide up because it's very important to remember that when you're dealing with patients and, patients are being prescribed medicines in hospital, it doesn't mean that you need to give the patient more medicine. Often you need to look at the patient when they're in hospital and you need to see what medications can we stop. This patient is very ill. We're giving them high doses of different antibiotics and steroids. Do they really need all the regular medications right now? I think the worst patients, well, not the worst, but I think one of the cases I saw about a year ago was a patient that came in, and including all their medicines, including like inhalers and creams and injections and all their tablets and capsules, they're on nearly 40 medications. So, that is a ridiculous amount of tablets and creams and injections to be taking every day. So, when they came in, obviously, we stopped most of their medications that they didn't need and focused on the ones that they needed urgently. So that's what I mean by dealing with complex patients. And sometimes the patients are so ill that they can't speak because they're asleep or they're just getting sick. So you really need to think outside the box when you're looking to find out what medications the patients are taking. You have to see, did they bring medicines in with them? Have they got a family member that you can contact? Have they got a doctor you can ring? One of the cool things that they brought in recently is a service where you can log on and you can see what the GP has recently prescribed, what the doctor has prescribed for them in their local GP surgery over the last couple of months. I think it's called summary care records is the correct terminology. And it's very, very useful because that way, if you want to find out what the patient's taking, you don't need to ring the doctor. you can literally log in online and you have all their information there. And of course, it's all protected. You have to get registered for the system. You can't just log in at home and see what the patient's taking. So the patient information is very protected, and that's one of the big challenges, I think, for most people's medical information, is that at the end of the day, it's very personal information and it has to be protected. So what else is there? So what kind of national incentives are there to improve practice, either working in hospital or even community? So in the UK, one of the organisations is called the Royal Pharmaceutical Society. So if you're a newly qualified pharmacist, one of the programs they have is called a foundation program. Now what they're hoping to do is they're hoping to connect the foundation. Another they have for established pharmacists called the faculty. They want to bring this together so that every pharmacist will undergo this program. So essentially what it is where you review your practice and you see what areas you're weak on. So a lot of countries have this thing called continuing professional development, or CPD. And again, they want to tie that into the whole thing of improving your practice and CPD. In Ireland, we have an organisation called the Irish Institute of Pharmacy. And again, they do the same thing. They're all about CPD. They're actually a very new organisation. So CPD is actually very new in Ireland, whereas in England, it's been around a couple of years, that you have to do a certain amount of cycles every year to improve your practice.
Dear Brendan, I'm really sorry to interrupt you. We are having some requests for removing the video, so perhaps that would help some of our users to hear and see you, hear you more clearly, so we can try this if you don't mind. Thank you very much.
That's okay. I'll just stop the video there. Is that okay?
Yes, thanks.
Okay. It's okay. I didn't know I was that ugly. It's okay. Okay, so how can students get involved? So, nationally at your own local student association, that's the best way to get experience or apply for placements. I know EPSA has a couple of programs, EAHP has programs as well, but they also have their annual conference every year, and students can attend it. I have attended 2 of the EAHP's annual conferences, one in Hamburg and one in Barcelona in Spain. So there you basically have the platform where you can engage and talk to either people who are working in hospital and even chief pharmacists who are in charge of hospitals. But like I say to most people who go to pharmacy events, if you go to a pharmacy event and you sit in the corner of the room and you don't say anything to anyone and don't talk to anyone, you're not going to get anything out of the pharmacy event. You really have to get stuck in there and introduce yourself and say, oh, I'm a pharmacy student in Croatia. I would love to get experience working in hospital. Have you got any placements? Can I do a summer placement? Can I come for a week and just see what the whole job is about? So this is how you get this experience. And also there's organizations like FIP as well. They have student packages as well. And they've actually got a conference coming up in Stockholm, pharmaceutical, where a congress is coming up. So you guys again should look into that because there's a student package for it. What else? So I basically put the slide in. This guy's name is Ravi. Essentially, why I put the slide in is because this man is a community pharmacist, but a couple of years ago he saw the need for pharmacists to be more involved in GP surgery, so to work directly with the doctor to see patients. So at this point in time, Ravi is now what they call an independent prescriber. So he runs his own clinics in the doctor's surgery. He prescribes medicine for the patient. He reviews them. He sorts out prescriptions for patients. So there's actually no engagement with the doctor whatsoever. I think it's important to highlight that doctors are experts at diagnosing patients and prescribing the initial treatment. But not many people know more about medicines than pharmacists. So if you have a patient who basically has a respiratory condition like COPD or asthma, or is a diabetic patient, and they need help with their medicines, why can't a pharmacist do it? So basically, he has started a whole national initiative in England to train up 500 GP pharmacists by 2018 or 2020. So this is really good news. This is a whole other avenue for pharmacists to work in. And there's a whole standard program now. So when you start working in a GP surgery, you have to undergo a program of further study. So again, you do the whole thing of when you're a trainee. You have to submit CPD, submit evidence that you're improving your practice and that you're ticking all the boxes for the outcomes. At the end of this whole process, it's usually I think, about 2 years through the full program, and at the same time you're working as a pharmacist. But you can also then go on and do what they call a prescribing course, that takes about 6 months. And again, you'll do that under the supervision of a doctor. And once you're signed off on that, then yes, you can literally prescribe any medicine you want. But generally, the advice is for an independent prescriber that you only prescribe medicines in the area you are best suited to. So if you specialize in, say, cardiovascular medicines, so for like blood pressure and things, then you should only really prescribe those medicines. You shouldn't really prescribe inhalers for a patient because that's not the area you specialize in. I hope that kind of makes sense of it, yeah? So again, you can follow Ravi there. That's his Twitter username there. What else am I going to talk about? So, I mean, like, thanks very much for the opportunity, guys. I think I've kind of gone a bit over time. I hope it was beneficial to have this. Thanks very much to CPSA for inviting me. It was really good. I have got a couple of other slides to go through, so I'll just go through them really quick, if that's okay.
Sure.
Oh, sorry.
No problem. Go ahead.
I put a couple of kind of not really funny quotes, but the kind of quotes that I like. One is you can do anything if you have enthusiasm. Enthusiasm is the yeast that makes your hope shine to the stars. Essentially, what it means is, guys, if you really want anything in life, you have to really go for it. It's not going to fall on your lap. And opportunities like working abroad or improving your own practice, they're not just going to appear out of nowhere. You really have to do it yourself. And the man who said that was Henry Ford, the guy who created Ford Motors in the USA. I've got another one, so I kind of use this the whole time just to annoy people because Irish is an actual language. It's not made up. So this is Irish. So it basically means "Na fána troll a fear mall," which of course everyone knows that time and tide wait for no man. So in other words, if you don't get involved and you don't get stuck in, then nothing's really going to change. You have to be the change that you want. Okay. So a couple of other bits. I put a couple of references there. If you guys want to find out. You guys might find it useful to look up those guys, the KSS in the UK. So they do the training in the south of England. They have lots of useful information on their website. A couple of things then, obviously I work with FIP, so their next conference is, they have a student package, and it's going to be in Stockholm in Sweden. And again, if you want to follow us, we're on Twitter, we're on Instagram, and we're also on Facebook as well. That's FIP. And if you want to follow me, guys, that's my Twitter username, Instagram, and I'm all those forms of social media as well. And that's basically it. So if you guys have any questions, just post them in the box and I'll try and read them. Is that okay?
So we usually read out the questions. So unfortunately, since you went a little bit over time, we will just do one question at the moment. And the other ones we will just pass through to your email if that's okay with you.
That's fine, that's okay.
Okay, sure. So Petra had posted the question first, so we shall give the chance to ask her question. And the question is, are there possibilities for recent graduates from other countries to become trainee in clinical pharmacy in the UK or Republic of Ireland?
Yes, there are. I know several students who completed their training in their own countries and then registered in the UK and registered in Ireland as well. I would say that clinical pharmacy is a bit behind in Ireland compared to the UK in that we don't have things like independent prescribers. We don't have, a lot of hospitals don't have electronic prescriptions. The health service is undergoing like loads of change at the moment because essentially they're finding it really hard to hire staff for certain areas. But pharmacy is improving. So basically with the UK then, clinical pharmacy, I mean the best way to do it essentially I think is either to try and do like a placement for 2 weeks, but then again, you'd have to contact the hospital directly and find out who's in charge of training and see if they'd be willing to do a placement like that. I know they do ones through the SEP program, through IPSF. You can do it that way as well, but obviously I think the UK is the second most applied to country after the USA for placements. So it's very tough that way. I know certain students who've got placements from other countries through the EAHP conference, but the only reason they got placements through it was that they were motivated and they went out and they found, people in different hospitals that spoke to them directly and asked if they could do a placement. I'd say it is a lengthy process, and if you really wanted to do it, definitely do it. But I mean, it'd take a bit of time. I'm not sure the logistics of a conversion course, because technically you are in the EU, so it won't be too hard to do it that way, but you have to register to be a pharmacist in with the GPHC, so with the regulator. The only thing you probably would need to provide as evidence is you're actually a registered pharmacist in your own country or a student, and you probably have to submit some kind of evidence of English that you're able to speak and work in the English language. I think that's it. I hope that answered your question.
Thank you very much, Brendan, and we're very grateful for your lecture. And you see that there's a lot of interest in the comment section, or chat section, should I say, but unfortunately we won't have time for this at the moment, since we are at the moment a little bit late with the schedule. So thank you, Brendan, once again.
Okay, cheers. Thanks very much, guys. Take care.
Thank you. Bye, Brendan.